All right. Welcome. All right. Welcome to the Next Fitness Show. Now, I just want to say, most of us now have been taught to pay attention to our hormones, right? And we usually are only paying attention to our hormones when something goes wrong. So maybe you're having trouble conceiving a baby, maybe you all of a sudden gained weight in perimenopause, or you're having hot flashes or something like that. And this show is really all about what if we paid attention to this before it became an emergency. So today we are talking about proactive hormone health. And we have an amazing guest here who is a veteran of this show. And we're so lucky to have her here with us. Gabby, would you please come on camera and say hi? Dr. Gabby Pavelko is here, and she is an expert in hormone health. Gabby, will you just, so Gabby is, my understanding is that you are you're an acupuncturist and a Chinese medicine doctor, and that you specialize specifically in hormone health. Um, please tell us anything else about you that you want us to know, but also, like, how did you get into this? How did this become your specialty?
Yeah, thank you so much, Alexis. It's always a pleasure to be here and join you. And um, it's funny, like we've known each other for a really long time, and I feel like I this has been a lifelong journey for me to get to this point. So I think, I have really been exposed to like a holistic view of health. When I was younger, I had really bad PMS from puberty. And I wish that we know now, we knew then what we know now. I was put on a hormonal birth control when I was 11, and I think I was on it until I was 30. So there were only two times I think in my life where I actually came off of it, mostly because I ran out of it and I was traveling and just like didn't have have access to get more. But it wasn't really until I was in my doctorate program that I started to really think about what it meant to not really understand my own body and my own hormones. And I think I really, was able to get exposure through food. I've worked in food my whole career, in innovation, fitness, obviously owning a fitness studio and community, which you were a huge part of back in the day. Mental health is a huge piece that I've also been kind of exploring. And when I first got into my doctorate program, I actually thought I would be treating people for mental health. And I do a lot of that. But then when I started to realize is like when you're treating people for mental health or addiction, a lot of times hormones are actually the root cause of that. And so I was like, let's actually even go back a step further and really look deeper into that. So I throughout the course of my doctorate, which was about 4 years, I was able to treat so many patients. And I think that the treatments and the people that really resonated the most with me were in this hormonal um, lifespan. And so, everywhere from puberty, where teenage girls come in now and say, I don't want to take birth control. I want to naturally, figure out a way to like not have PMS. PMS is not normal. And I know like we don't want to use the word normal, but I think that like people should realize like you should not suffer. Like women, especially, we suffer so much and we should not be suffering. And I think working with women and having them understand, how you can work on yourself and help your body help heal itself without being on birth control is like a huge part of puberty. Fertility is so interesting because I think a lot of times that falls on the woman, but it's actually 50-50, the woman and the man. So I treat both women and men for fertility. Postpartum is a huge area that not a lot of people talk about, also miscarriage. And that's a huge part of fertility. And it's just so isolating. And you're not really sure where to go or how to get help. So I work with a lot of those people. And then perimenopause and menopause, I feel like has exploded onto the scene a few years ago, and everyone's talking about it, but yet there's still not really a full understanding or solution for women. And I'm myself, I just turned 41 in January, feeling a lot of symptoms, and everyone says, that's really young. That might sound really young, but I treat women who are as early as in their 30s, or if you have to have surgery or if you have breast cancer or something, you might actually be forced into early menopause. So it could even be younger than that. So yeah, there's a
Yeah,
lot, I think, of myths and misconceptions around hormones that we're finally talking about.
that's awesome. It's amazing. Okay, so many things of what you just said. First of all, I'm a little shocked to hear that you're not supposed to suffer in PMS. It just seemed like that's like part of life, that of course that's what happens, that's what you do. And so I'm a bit shocked to hear that. I can really relate to what you're saying about being put on birth control. Similar thing happened to me. I think it's actually super common actually, to just be put on birth control. It seemed like it when I was in college. Like I wasn't getting my period. It turned out they diagnosed me with polycystic ovarian syndrome, but there wasn't any other evidence that I had. I guess they just changed the name. So there were no cysts, is what I'm trying to say. But now I think in the new, it's like PMOS instead of PCOS. I don't know exactly what the word is now, but I probably did qualify for that. But they just put me on birth control. Did that solve the problem? No, it just made me bleed. Okay. Like,
Yeah, I mean, it's so interesting, right? Like I have heard this story from so many people. Like I had cystic acne, I was losing my hair, I had really bad PMS every month, and they just diagnosed me as having PCOS because for a lot of people, it's actually sort of like a diagnosis that is a catch-all. So it's like if they've
right.
tried to figure out what you have and they can't figure it out, you have PCOS. Like it
Right.
used to be sort of known for that. But yeah, now it is called PMOS, and it actually has a lot more to do with like your metabolic system, which like makes a ton more sense. And I think what we're
Yep.
starting to understand and realize is that our bodies are so interconnected, and there's so many things from, like the microbiome and digestion that affect mental health, that affect hormones, that affect your athletic performance, that affect your strength. But yeah, I mean, I'm going to tell you, when I was in my doctorate and I was taking, first you take Western gynecology and then you take Eastern gynecology. I
Okay.
think that was actually the first time I learned about like really, really learned about hormones and female anatomy and about PMS not being something that everyone experiences or has to experience. And I was like, in my 30s. And I think that I talk to a lot of women who are like in their 40s, 50s, 60s who are not even having a period anymore or are, and are like, yeah, what? Like, how is this not something that we talk about in middle school when we're talking about health classes and learning about our bodies
Yeah,
and
right.
all of that? I mean, that's, I think, the right point, or even
Well, it's like they
earlier, where
don't
we
even
should be
have the
learning about this.
information, it seems like. The information that we have seems to be really limited. And so then, I mean, I should, when I say we, I mean the general public of, health information seems really limited. So that's why I'm excited to talk to you because I feel like you have this much deeper understanding. And I really do really, I was curious, you brought up like, perimenopause, talking about this is all the rage. I was like, is this only because I am this age? And so this is the algorithm that makes it seem like everybody's talking about this, or is it actually that more people are talking about this?
Yeah, I think more people are talking about it. The baby boomers and Gen X did so much for moving forward this movement for the younger generations. I mean, I can't say enough about a lot of people say, "Oh, my mom never talked to me about it. My mom never talked to me about it." Well, moms are now talking about it with their daughters. And I think obviously there's a lot of societal reasons why that's the case, but right now, since women are waiting later to have children, they're
Mm,
actually having children when, like their daughters are getting puberty while they're going through perimenopause and menopause. So it's like a perfect time to actually be like, you're starting and I'm kind of finishing, right? But it's not finishing, it's actually a new start. And I think that's the thing that most women need to realize is like we have this whole negative perspective around aging, and perimenopause is like a dirty word. A lot of brands are campaigning around we should stop using these words because it puts you into a bucket of like you're no longer desirable because you're no longer having children. But in other cultures it's celebrated, and it's like, really a time where like you get to be you. You get to focus on yourself. You get to not, as a woman, like necessarily focus on all these other things. But the reality is, you have kids, you have aging parents, you have a career, you have all these things that like didn't women didn't have in the past. And also women never really lived long enough. We're living longer now where menopause, once you've completed your cycle, could be a third or a fourth of your life, depending on how long you live. On
hmm.
average, women are going to stop having their cycles around the age of 51. So if you
Okay.
live to be 80, if you live to be 100, I mean, that's half your life without a
Wow.
cycle.
I hadn't thought of
But
that.
we our health really suffers once our hormones go through that decline, because our hormones actually affect every single system of our body, our
Hmm.
brain, our digestion, our bones. And I think there's just so much more that we're researching and understanding right now that we need to start talking more about.
Okay, that's awesome. I want to acknowledge the chat. Right now, live in the chat, Megan's saying happy Friday. My mom's in there saying yay. Trainer Kathy's in the house saying, I love when doctors go to the root cause. So many skip that part of it. And so, yes, we suffer for years and throw meds that will never truly work because it's not at the root. Thank you. That's awesome. And Lisa B's in here saying hello too. I'm curious to the chat. When did you start actually thinking about hormones? When was the first time you really thought about your hormones? Was it in your teens, in your 20s, 30s, 40s, 50s, 60s, 70s? When was the first time? So please put that in the chat. I would love to hear that. Um, okay, so I guess my next question for you, Gabby, is just like, what does it actually mean to be proactive with your hormones? What do you mean when you say that?
Yeah, I think it's having the knowledge, right? And the awareness of what is happening. And I mean, I can't even take credit. There are so many amazing experts out there who are talking about a lot of different things. And I think making it more simplistic and easy to understand is one way that we can all share this information with like our friends and family and the people we care about. And this one doctor, her name's Dr. Amy Day. She's actually my naturopath, and she was just featured in the M Factor movie about perimenopause. She actually calls perimenopause like puberty in reverse. And I love this concept because the way that she frames it is like when you're going through puberty, you ask someone like, when does puberty end? And the question is, I don't know. Like, when does it actually officially end? It starts when you start to have all these symptoms, like you start growing hair, different places, you start having a cycle, you start, growing, different parts of your body. And then the question is like, when does perimenopause start? If it's like, when does puberty end? It's like, when does perimenopause start? And I think there's not really a good answer to that either. And it's like, how does it start? Well, it starts in a variety of ways for a lot of women. There's like so many symptoms. And I think that, your question of like, when did you start thinking about your hormones? For a lot of women, it's puberty. And then they don't think about it again until they're trying to get pregnant. And then they don't think about it again until they start to go through perimenopause. But being proactive is actually when you're younger, knowing that there are things you can do that through the course of your life will actually make it easier for you to conceive, for you to go through perimenopause and menopause and not experience extreme symptoms.
Mm-hmm. Right. Okay. I love hearing that, actually. Megan's in the chat right now saying, I've got that puberty in reverse thing right now. I had it much easier the first time around. Hopefully, there's a little less like awkward locker room situation. Uh-oh, Gabby has a issue with her connection. She'll be right back. Um, and I'm just really curious for you guys. Oh, Kathy is in the chat right now. Nice, you're back. Good. Kathy's in the chat right now saying it's our job to switch the narrative by showing the women coming behind us that it is not a negative. Yes, I love that. And I love hearing that from you, Gabby. And even just for me, I feel like there's like a lot of grief around this transition right now, actually. And so it's very helpful and supportive to just hear your perspective on this and also just to remember like and actually talk about it. Like it's not only happening to me, it's actually happening to like all of us. So that feels a little bit better, I think. But I'm curious, like, okay, you're saying that people are only thinking about their hormones at times like, all of a sudden your boobs are growing or something, and like all of a sudden you want to get pregnant or whatever. But what are some of the ways that people's hormones are affecting them that they haven't been thinking of at any of these phases?
And I think to just like go back to like basics, a hormone is actually like a signal in your body. And so the hormones that most people talk about when they talk about like women's health is estrogen, progesterone, testosterone. But melatonin is technically a hormone. So is insulin. Like
Oh,
there are, yeah, and cortisol. It's like you don't even realize that all these things that we talk about are other types of hormones that actually affect your body. GLP-1s are actually a hormone.
huh.
And so, yeah, it's interesting that like we think about it in such like a women have these hormones, men have these hormones. And I think the dispelling of myths is also like women have a lot of testosterone and men also have estrogen and, like in their body as well. So it's like, it's kind of like, oh, estrogen is like the female hormone and testosterone is the male hormone. It's like, that's all made up. Like we both have both. So, and I think what's also really fascinating is not to leave the men out, but andropause is what we call the menopause equivalent for men. And we're not even going to be talking about that for probably like 20 or 25 years, but they also go through a process and they also go through, but this is fascinating. Women and men have a, daily we wake up in the morning, we go to bed at night, right? So that's one cycle that we both go through. Um,
Okay.
Women, though, have a monthly cycle. Men don't have
Hmm.
that, right? So we have our menstrual cycle and we go through that. Men don't have that. We all have annual cycles, where we go through different things. Both of us do. But this monthly cycle is unique to women. And I don't know that a lot of people realize that. Also, your hormones fluctuate daily. So there are suggestions when you're going to get like your blood drawn. It really like these are basic things that I had never really heard before I started working with Dr. Amy, too, where it's like you should always try to go on either like day 3 of your cycle and always go in the morning or go at like day 19, 20, depending on how long your cycle is. Because day 3, when you're just starting your cycle, is usually a good point to see like the low of like a lot of your hormones. And day 19 or 20 is usually when you want to see the high. But if you're just randomly getting your blood test and you're getting your hormones tested, they fluctuate throughout the day, throughout the month, throughout the year. So that's not actually super helpful to have a
Whoa.
baseline that's going to change a lot. And blood tests are a snapshot in time, right? And you can do other types of like there's something called a Dutch test. It's a dried urine test. So you actually like pee on a stick over the course of 24 hours. And so it actually shows you different um, hormones and their metabolites throughout the course of 24 hours. So that's
Oh,
kind of
wow.
interesting. But
Okay.
there's actually this whole movement right now where there's a race for continuous hormone monitoring, meaning something almost like an Apple Watch, where you can see your hormones fluctuate throughout the day. I
Uh-huh.
don't think that there's a perfect solution out on the market just yet. And also, I think a lot of that information is going to be overwhelming for most people since
Right.
we don't even have an understanding today of the very basics of hormones. To have all of that information at your fingertips all of a sudden is a lot.
Right. And why would someone want to get their hormones tested? Who do you think should get their hormones tested?
So this is a huge debate in the medical community, and I would say it's split right down the middle. And this is also, I think, really confusing for women. But you might go to your PCP, like your primary care physician, for your annual, and you're going to say, "I would like to have my hormones tested," and they're like, "Why?" Like that's not something that they actually include in a basic test usually. And I would say I want to have a baseline. I want to just see where I am today. It doesn't matter your age, you can get a baseline, but it is really helpful to get, a full thyroid panel, a full cortisol, liver, like blood, all of the vitamins, minerals, all of those types of tests as well. And then getting free, testosterone, total testosterone, free T3, like all of that sort of stuff, like is really helpful because it's really okay. Also, another thing that's really helpful to do is make a spreadsheet or write it on a piece of paper if you're not a digital person, but look at your blood tests over time. I think that's the other thing is like if you actually start to keep this for yourself, it gives you an idea of like where I started. Yeah, like from when I was 20, I have all these like blood test results. I started putting them actually like into a spreadsheet and looking at here's where I was and here's where I am now. So you just start to like understand and learn about your own body. Also, I think it is really helpful to track your cycle. Because I think the cycle is actually like the fifth vital sign, a lot of doctors have been saying. And what I say by tracking it is you don't have to put it in an app. You don't have to trust digital things. You could literally print out a piece of paper and keep track of like any symptoms that you're experiencing, the days that you get it, how long it is, how painful it is, any symptoms that you're seeing. And that's really helpful information to bring into a doctor as a fifth vital sign. But a lot of doctors say, especially around perimenopause, that testing hormones is not super helpful because your hormones might come back and look normal or whatever. And so they'll say, "Oh, everything looks great, see you again in a year or see you again in 6 months." But you're sitting there and saying, "But I don't feel optimal and I don't feel good." And so they're actually using your symptoms to diagnose you in perimenopause. So you might, you know your cycle might be changing, you might be growing hair on your face, you might be having hormonal acne, you might be gaining weight, you might be losing muscle really quickly. You might be having joint pain. They start to look at these cluster of symptoms and say, okay, that sounds like perimenopause. And this is where it gets really confusing because that could be perimenopause, but that could also be like a thyroid disorder, or that could also be like cortisol, or that could also be a blood sugar thing. And so not to say like if you have all those symptoms, you're in perimenopause, because a lot of these conditions actually start to look the same around that age. And I think that's what makes women's health like so complicated.
Right, right. It's like it sounds like if you have a baseline established already, then when you go in when something is happening, they're going to compare you to the baseline. But if you don't have a baseline established already, then when you go in, they're going to compare you to some kind of national average or something like that, and you don't really know because everybody's kind of different if that's going to be this if your normal is where it goes in the average, because that's, I don't know, I mean, I'm not an expert in this, but I'm just like, after navigating so much medical stuff with my parents, it's like comparing it to normal and comparing it to what's normal for you is like not the same thing.
No, and I think like I have my own experience as like a funny example, but I went to my primary care physician at a women's health clinic, and she took my blood, and I actually told her everything I wanted to have tested. And I really advocated for myself, what you have to do. And I got all the test results back, and she said, everything looks great. And I was like, but it's not normal. I'm experiencing extremely heavy bleeding. So they did a pelvic ultrasound to see if I had, endometriosis or PCOS. And that all came back normal. And she said, I cannot diagnose you with perimenopause. And then I went and did an appointment with MIDI Health, which is a telemedicine provider that is for perimenopause. And I got on with the practitioner, and immediately, based on the symptoms I had provided in the intake form, she said, I am diagnosing you with perimenopause. And those two appointments happened like a week apart from each other. And so that's very confusing. And I'm a practitioner.
Wow, that's wild. Right.
Yeah. And
In the
that
chat,
is,
go ahead, keep going.
I was going to say, that is what makes it so confusing for women, is that the doctors and their education is not necessarily up to speed yet. So, another thing that's going to blow your mind is women go to their gynecologist at this point in their life. Gynecologists are surgeons who have been trained to give birth and to understand about giving birth. They have not been trained or received training about menopause. So women go to their gynecologists to get help, but these women, I mean, gynecologists, are men and women, receive about 1 hour in their entire medical school about menopause, if they even get that training. So that is why there is so much confusion in the gynecology community about this. And so there are organizations like the American, they're called ACOG. They, are really trying to get more education to gynecologists in their continuing education units if they're not receiving it, but also trying to get more education when they're actually in medical school. But the problem is these types of like system-wide changes take like 20 to 25 years to
Right.
affect. So we are starting to see some things changing, but it's very slow.
Okay, so if somebody's like, wants, let's say just someone like me, you're like, okay, I know that I'm like right at this perimenopause place. I know I'm not sure what if am I supposed to do something about this? Maybe I want to get tested. Like what kind of doctor would I, or maybe it's not a doctor, but who should I go to seek the help in order to really get the help? And how do I know if that person is going to help me or if that's not going to be a good person to help me?
So what we see today is most women either go to their primary care physician, their PCP, because they're going in for their annual physical or what have you. So they're doing that. A lot of those doctors are also not trained in menopause in medical school, um, or they're starting to have mental health symptoms. Mental health symptoms for a lot of women during perimenopause is actually the first symptom. So maybe you're not sleeping, maybe you're experiencing brain fog, maybe you're experiencing anxiety for the first time, maybe your depression is increasing, maybe you're experiencing anhedonia, which is actually the feeling of nothing. It's like flatness. Um, and I've experienced a lot of those things. And a lot of women actually start to seek help from a therapist or from a psychologist
Mm.
or a psychiatrist. I think what we're starting to see is that they're also going to their gynecologists. But again, a lot of these doctors are not trained. Like all of the groups of people that women are going to are not trained to work with perimenopause. So they're starting to be. ACOG has actually started to create a database of the gynecologists that have received training and that are able to, like, they're considered menopause specialists. Would to start building your team. And what I mean by that is I have a naturopath, I have an acupuncturist, I have a chiropractor, I have a fitness trainer, I have a physical therapist, I have a doctor, I have a gynecologist, and it's like all of them we're working together to sort of solve everything that comes up. And it starts to feel, and something that women say a lot when they're going through this stage is, I just don't feel like myself. And when you don't feel like yourself is actually the hardest time to seek help for
Yeah,
yourself.
right. Hmm.
So that's why I really encourage you, like, it doesn't matter your age, but really start to build your team of practitioners so you can get your baseline. So when you start to not feel like yourself, like they also understand it. But if you're seeking these people to help you when you already don't feel like yourself, they don't really have anything to compare it to either.
Right.
Um, and so a lot of women are put on SSRIs, antidepressants, which can help with some of those symptoms. A lot of women are put on hormone replacement therapy. A lot of women are put on birth control again
Yeah.
during this time because they think that might help, just sort of like quiet the hormones and like distract from the symptoms and stuff like that. So but I would say there is no like right solution. The solution that's right for you is the one that ends your suffering, right? So I am a big proponent of women should never suffer. If you have pain, if you have anxiety, if you have anything, you should seek help and you should try to find doctors that market themselves or speak that they understand perimenopause. So you might have been going to a doctor your entire life. Guess what? You can fire that doctor and find a new one. If you go to them and you ask them for help and they can't give it to you, right? So it's hard. It's really hard to find that team, but it's really worth it. It really, really is because once you start to feel better, it means everything.
Right. Okay. And then that's super helpful. The what about for women who are menopausal? Like, are they still supposed to be concerned about their hormones or are they just done or what happens for them?
Yeah, so basically, um, what perimenopause is and what it has been described as is kind of the zone of chaos. So when you go through puberty, it's like when your body actually starts producing estrogen and progesterone and testosterone. And for, call that around on average the age of like 12, 13, 14, like throughout your life, you're pretty much like you have a lot of it. It's going through its daily and monthly cycles, but it's kind of like up here. All of a sudden in perimenopause, you're starting to um, experience like a lot of changes in that baseline. So it starts to look like this. Like it's crazy when you look at a chart of what's happening to your hormones during perimenopause. So your progesterone starts to decline for a lot of women before. And so that's why they experience issues with sleeping or with anxiety or with stress because like progesterone really is like a feel good hormone. And what's tough about that is if you have a lot of stressors in your daily life and your cortisol is pretty high, you actually can't make progesterone. Your body like shuts it down. And that's a protective mechanism. So for a lot of women, that's actually why they have issues getting pregnant. If they have too much stress in their life, their body's not making progesterone, and you need to make progesterone to also get pregnant. So that's a really important thing to look at. So, um, you can supplement progesterone. And this is also really confusing because when we're on synthetic birth control, there's progestin in it, which kind of sounds like progesterone. And um, progesterone is what your body actually produces. Progestin is like a synthetic form of that. When people are supplementing and taking progesterone, a lot of times if it's considered like bioidentical, it's actually made from like a wild yam. So it is like plant-based. They have found that, similar to the progesterone we make, you can actually find it in this wild yam, which all sounds great. And you can take it as a cream and you can take it as a pill and you can do all of that sort of stuff. I tried to take it as a cream. I tried to take it as a pill, and about 40% of women don't actually tolerate progesterone. And I am one of those women. And how that manifests and is extreme mental health things. So I actually, being a practitioner in this space, was experiencing, not being able to sleep, having extreme brain fog. And so I started taking progesterone to help with sleep. It worked for a couple weeks and then it stopped working. And instead, I started to get really like weird headaches and my heart started to pound really fast. And so I went to the emergency room and I was like, I have learned in all my training, when there's something going on with your head and there's something going on with your heart, you go to someone else, right? You refer out. And so I went to the emergency room and they tested everything. And I have to say that the doctor, he's very young, he told me I was too young to be in menopause, but he said something that really I appreciated. And it was, you know, the good news is there's nothing seriously wrong with you. The bad news is that you are on a very long journey to figure out what it is that's making you feel this way. And I think that is the moral of the story of hormone health. And I have talked to so many women since sharing that story who have also, they might be doctors, they might be advocates in the space, have also gone to the emergency room and had the exact same experience. And you get this bill from the emergency room and you're like, oh, and the bill from going to see all these practitioners and all these specialists for perimenopause, because a lot of it is not covered by health insurance. And you really start to think like, wow, this is something where I think the system can be better.
Yeah, right. Totally. I mean, I'm just, whoa. Okay. But like, so if you, circling back to my original question, the people who are already past menopause,
Yeah.
what is like, tell us a little bit of what they should be expecting and are their hormones still a factor?
So there's also this really interesting thing that's happening right now, which is so if you are in your 30s, 40s, and you start to experience symptoms and you get onto hormone replacement therapy, they used to say, be on it for about 10 years and then you can come off of it. What they're starting to say is you can stay on it for the rest of your life. And I know a lot of women who are like, I want to be buried with my hormone replacement therapy because they love it that much, right? Um, but if you, like a lot of women, because the Women's Health Initiative was a study that was actually done throughout the 90s, and it was the largest, most expensive women's health study ever done. But this, I don't know if a lot of you remember, around 2002, study like results started to come out from the study where they actually started sharing that taking hormones and hormone replacement therapy increased the risk of breast cancer and increased the risk of a lot of things. What they so everyone sort of stopped prescribing, shut down the research, all of that sort of stuff. What they are starting to really understand and show now is that the way that the results from that study were analyzed was not correct. And so it really like did a disservice to all women because a lot of women stopped being prescribed that. But so women who are like 60 right now and have already passed menopause, it's not just like they have no symptoms. It's not just that they don't have to worry about their hormones anymore. After the chaos of perimenopause, you actually go back to a normal like state, but it is a much lower state. So like say your hormones start here, they might end like here. Right. So there is a final, like there is a normalization that happens again after perimenopause, and that is called postmenopause. And you're going to have that for the rest of your life. But the reality is, there are symptoms that are still associated with that. And it really affects a lot of women. But if they have not been on hormonal birth control or a hormonal replacement therapy, then to start it is not necessarily a good idea for everyone. And the reason why there's a few reasons why. Um, Women, our arteries and our veins are narrow. Men's are actually wider. And so if you have calcium buildup or anything like that, which is actually something that can happen as your hormones decrease, and you start to take hormonal birth control or um, hormone replacement therapy, and that's why there's actually like a warning around blood clots with hormonal birth control, is you could actually have like a cardiac event. And so you really want to make sure that if you're like in your 60s or 70s and you're watching this and you're like, I want to get on hormone replacement therapy for the first time, you should really consult a doctor who can, test your the plaque buildup and everything in your arteries and veins and make sure that you go through it. But there's a risk profile for all women, no matter what your age, and to really understand like what is the history of breast cancer in your family. That is actually for a lot of women a non-starter for doctors. They will not prescribe you hormone replacement therapy if you have had breast cancer or if anyone in your family has. What they're starting to see though is that when they start to have a conversation with you around risk, like that's when you really get to again advocate for yourself and say, like, I want this even though that, or like you understand the benefits and the risks and you get to make a decision for yourself. So I think like this is how it's starting to evolve. But yeah, I mean, I know that's a lot to answer. But women who have gone through menopause, we are more susceptible to things like Alzheimer's, bone density issues, heart, you know, events, cardiac events. So there's just so much that still needs to be researched and still needs to be studied. Um, but that's why it's just so important that no matter what your age, you start to really have conversations and think more about your hormones.
hmm I want to bring in a question. My mom specifically was like, make sure you ask her about frozen shoulder. What's going on with that? So I want to see what you have to say about frozen shoulder.
Yeah. So it's so funny. I, as an acupuncturist, have been treating women who come in with frozen shoulder for so long. I think since I was even doing my residency. And I always thought, and what we learned is that frozen shoulder means you have a limited range of motion. So a lot of women, when they get frozen shoulder, like they can't raise their arm up and it's painful. I was actually, it's kind of funny, but I was in New York and I was actually filming a PSA, a public service announcement about menopause with these like older women. And I like moved my arm and I said, oh my gosh, did I just get electrocuted? And they just all start laughing and they're like, welcome to perimenopause. And I'm just like confused. I'm like, what are they talking about? And they're like, that's frozen shoulder. And I was like, frozen shoulder is what? And what is that feeling? And I can't even describe it to you, but if you've never had that electric jolt, like if you accidentally touch a, wire or something like that, that is the feeling that I felt like running through my shoulder. And so I started to look into it for myself. I actually was able to really acupuncture, like really helped my frozen shoulder. But I couldn't do it on myself because I'm right-handed. And so I had to go get it done by another acupuncturist. But there is still a lot of debate, I would say, about whether or not and how exactly frozen shoulder is related to hormones. And or if it is, but a lot of women in perimenopause experience frozen shoulder as like their first symptom. And it also goes along with, joint pain. It goes along with, there's so many really interesting symptoms and they get weirder and weirder by the day, like itchy ears, an increased sense of smell, so many things. And this just really, your gums burning. This really goes to show that like menopause and hormones affect every single system in your body. I got a very weird symptom. My last symptom that I had was I was reading a book and all of a sudden the vision in my left eye went blurry. Like it is wild. It is a complete roller coaster of emotion. And it is just it's hard to explain until you're in it. And then I think the way to really like you can make it kind of funny. Like my friends and I actually have like a weekly call where we're like, okay, what's the weirdest thing that happened to you this week? And also you can be like your own detective about it. So I really start to look into like frozen shoulder, like how does that happen? Why does that happen? And read different opinions online. And I think it's really confusing because there's a lot of bad information out there. But um, know that every time that you feel or something doesn't feel right, notice that, write it down, make sure you are keeping track of like when it's happening, how it's happening, is it intensifying, is it getting better? Because it's so important. I cannot stress enough during this hormonal transition to like have a baseline and then to really understand the things that are changing and then whatever your new baseline is going to be.
Right. Okay. That's great advice. And speaking of this, I think it's time for a stretch break. So the stretch break this week is actually chosen by Gabby. And it was so funny because, I mean, we've known each other for a long time. And she sent me, I was like, what's your favorite stretch? She's like, hamstring scoop. And I was like, hmm. And then I was like, I think it's this. And then I showed it to her. She's like, yeah, exactly. And I was like, perfect, perfect, good. We're speaking the same language. It's awesome. So this is what we're calling hamstring scoop. I love that name for it. We're gonna change the name in the app to hamstring scoop. It was just in there as dynamic hamstring stretch. So hamstring scoop is a perfect way to describe this. Why did you choose this? What do you like about this one?
So I feel like I've been really focused on strength training these days. And, when you do a lot of strength training, your hamstrings can be really tight.
Hmm.
And this is just a really basic stretch, but you feel it and it's fun. It's not like, ow, in a bad way. You're like, okay, I feel like I can tolerate this pain.
Yeah, totally. Kathy's in the chat saying, love this stretch. Totally. I love this one because it's dynamic. And I think a lot of times when we're doing hamstring stretching, people think of like, oh yeah, bend over and touch your toes. And don't get me wrong, forward fold is cool and all. It's great. I do it all the time. And to actually progress flexibility, it usually takes doing something dynamic. And this is a great way to actually do a dynamic hamstring stretch, and it's sort of showing you what's going on with the backside of your body. I love that she does it in dorsiflexion just to keep the posterior chain, like the backside of your body is actually turned on when you're doing this because she has her toes curled back. And so that's going to make it so that the muscles that you're stretching are active at the same time that you're stretching them, which is protective basically. It's also conducive to progressing your flexibility when your muscles active while you're stretching it. So that's helpful too. And of course, Veronica, as she's modeling this, is amazing. And she's really good at demonstrating the neutral spine while she does it. And I think that that's maybe not common, especially as I'm watching people take class and even watching myself in the mirror. So just want to point out, like, do your best, keep your spine neutral as you hinge forward, and you will get more out of it, even if you don't go as far down, by keeping your heart open rather than collapsing over as you bend over. Cool. I love this one. Okay. And with that, okay, I just want to bring this in one more time for you, Gabby. And um we do still have announcements and a couple other things, but what do you actually want for people? The things I've heard so far is like you need to be your own advocate. You need to get a baseline and to track what's going on. Is there anything else as far as being proactive that you really want to put a bullet point on and make sure that people are getting out of this conversation?
Yeah, start to build your team. And I mean,
Mm.
not just your team of doctors, but like your team of friends, your team of community. Because I think that also what happens during a lot of these hormonal transitions in a woman's life is it is very isolating. I have so many friends who have come to me and said, I feel like I can't really talk to anyone else, but I had a miscarriage. And this is like the most awful thing because I couldn't even really talk to my partner like about all the things that I went through. And I think, in perimenopause, a lot of really embarrassing, weird stuff happens to your body. Same thing in puberty, right? But none of it is weird or embarrassing. And there's a ton of shame and stigma placed around all of this stuff. But I met a woman yesterday who was like, it's actually all a superpower. And I think that's the way we really need to think about it is she was like, when you tell someone I'm on my period, like it's like this is what you can expect from me this week. Like, and I love that. It's like I've worked in teams with all women where we actually get on a call and all share where we are in our cycle. It's like, hey, I'm actually feeling like really energized this week because I'm ovulating. And so, I think we should all like give me, extra work to do this week. But like, if you're feeling low energy, then like, you don't have to be on this call. Like, that is a world I want to live in.
Oh, 100%. Me too. I mean, I have this like Native American group that does a retreat at my house. And they have a tent for for women who are bleeding. And if you are bleeding, you sit in this tent and they serve you. Everyone serves you. Like you just are not expected to help. You're not expected to do anything except for, take care and restore while everyone else just like cares for you. And it's like, wow. Hmm. How many
I
women are
love it.
still caring for everyone else in that state, like to their own, detriment
Yeah,
sometimes?
I love it. And I think also like a fascinating conversation starter is I'm a big fan of Gabrielle Lyon. She has an awesome name. She's a doctor as well. She actually looked into some research recently about the suggestion that women shouldn't work out when they're on their cycle. And I think this is a huge debate that is like of the forefront in a lot of influencer circles and all of this sort of stuff today with cycle syncing and all of that. But her point is really, listen to your body. And I think that is the other thing always, right? Is listen to your body and do what your body is telling you to. Like symptoms are your body actually screaming at you, like, listen to me, right? So I think, I strength train during when I am on my period, but I might not go as hard, right? I might not like do everything that I would do otherwise. But what she's trying to say is this advice of like, only go for a walk or only take yoga, it actually sets you back in terms of your strength training for life. Like you can never catch up because at a certain point, like your muscles stop to like increase their strength. And I'm just trying to keep my strength. So like I'm fighting this like battle right now, right? And so if you give up a week every month where you're not doing any strength training, like you're really setting yourself back. And so I thought that was just super interesting and I wanted to bring that into the conversation as
Yeah,
well.
I'm glad you did. Actually, I think that's really interesting advice because I've been hearing that as well. And I mean, especially I read like two of Stacey Sims books, did her whole course and the whole thing, which I love her, don't get me wrong. And like I don't think she would advocate for not working out on your period, actually. But she was saying that in an endurance event, like where you go into the med tent, I don't remember the exact statistic, but it was an overwhelming percentage of women in that tent who were hurt, like at a race, basically. And they were almost all on their period. Yeah. But there's a big difference between being at a race where you're trying to go your fastest that you would ever go and you've been training this forever and actually showing up to your strength training workout and doing what you can do without overdoing it.
Yeah, and I think the other advice is a lot of doctors are worried, there's not a lot of research, there's like none about pregnant women because no one wants to be poking and prodding a pregnant woman and be the cause of like a miscarriage or anything like that. But the advice that I've seen, a lot of really active women in my life take is what you have been doing your whole life, continue to do in your pregnancy. And so what that means is like, I know a woman who has run marathons like weekly for her whole life. She ran a marathon at 9 months, like
Oh,
very pregnant. And like she had a very happy and healthy baby. Like,
She
don't
had a
start
marathon
running.
running baby.
Yeah, like
Wow.
don't start running a marathon in month 9 of your pregnancy if you've never run a marathon in your life. Like I would not recommend that, right? Like so it's like if you and I think this is the thing, right? Like there is no magic pill. Like really, truly, even hormone replacement therapy, a lot of women start taking it and really hope it's going to solve all their problems, and that's not what's happening. And I think like this is the bad news of the day is that the things that really 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 affect your hormone health are the basics: the food you eat, how much sleep you get every night, the amount that you move your body, and the resilience you build towards stress. And those are the things that you can do at any age and you can work on at any age, and those are the exact same things I do for people in puberty, for fertility, and for perimenopause and menopause. And so we all know the things that we like should be or could be doing, but yet we're still looking for this like magic pill. It's like, no, you actually need to go back and do all the things you should or could be doing. And then you start to look at things that you can supplement. So I
Hmm.
don't recommend, just getting on supplements or getting on anything. First, you really need to go back to those basics before you add anything into your routine.
I feel like we've been getting this advice so many times. I keep hearing this, and I just love that it's coming from so many angles. Like, work the basics. You got to have your foundation together before you start going all off into the weeds. I love hearing this, and I'm so glad to hear you saying it, actually. Okay, I want to do announcements real quick from the next fitness thing. All right, you guys. So here's what's happening this week. For one, we are now 2 weeks into Find Your Fit on YouTube. It has been awesome. This class is every day, Monday through Friday, 9:30 a.m. Pacific. Mondays is strength, Tuesdays is TRX, Wednesdays is walking, Thursdays is Pilates, and Fridays yoga, and you can join it. You go to the nextfitnessthing.com/findyourfit. And for members, I mean, honestly, for everybody, you're going to be getting like a whole welcome kit and all of those kinds of things. And it's been really, really fun. So for those of you who are here on YouTube that are not members of the Next Fitness Thing, this is a great way for you to get a feel for what we're doing. Okay. Our next community event is on Saturday, August 22nd. So it's not tomorrow. It's a week from tomorrow. This is our Dog Day Safari. This is your call to go find a dog that you can walk for this event. You're going to take them on a safari and it's going to be so fun. So if you want to join this is also a free event. The nextfitnessthing.com/dog days. You can sign up. You don't have to have a membership or anything. You can just sign up and join us. Okay, and our book club for the month of August, we have our walking book club, and this is going to be with trainer Melissa. She not only is hosting this book club, but she co-wrote this book. It's called On the Road to Nowhere, and if you want the link to find the book, whether it's an ebook or a physical book, it's at the nextfitnessthing.com/book club. Okay. And I just want to call out Melissa because she's not only leading that book club, but she's a English teacher and she's going back to school. So she will still be on our schedule, but it won't be Friday mornings at 6 a.m. after next week. So you have tomorrow, what was it today? It was today. You have today, which already happened. So I guess I wrote 2 weeks because I did this before it happened. But you only have 1 week left to take her class at Friday morning at 6 a.m. So go take advantage of that. Of course, there's bunch of recordings of her class, but I will be announcing when her new time on the schedule is. But just show her some love and show up to her Friday morning class next week. It's going to be her last one at that time. Okay. And what else? Gabby, it has been amazing to have this conversation with you. It's been eye-opening. I need to go back and watch this again and take notes on the things you said because it just blew my mind. The chat has been really active too, and I have not actually been calling it in as much as I probably could have. But I just want to say thank you to Kathy and to Marissa and Megan and Lisa and mom and everybody else who's here live for contributing in the chat and keep the conversation going. Um, if you guys want to stay connected with Gabby, she's an amazing resource and just amazing person. So I'm gonna put her info up here on the screen so that you can find her. Here's her Instagram and her name. And Gabby, what else? Is there anything else that you want to say to the people?
No, please connect with me if you have any questions, and if I can help and point you in the right direction. And thank you so much, Alexis. This is so amazing and inspiring, and I love to be part of your community.
Ah, thank you. And I would love to put that directory that you were talking about up in the description. So maybe you'll send me that afterward and I can actually put the link to it so that you guys can be able to find practitioners and build your team the way that Gabby is encouraging you to do.